Sort of review your medical history, and I'm nervous because you're filming me.
Sorry.
But basically understand that you have some, the seizure disorder for which they're doing, or no, you had the tumor for which they took out, which is what causes your pain, is that right?
Correct.
And you take some OxyContin for that and the oxycodone.
Mm-hmm.
And did you take that this morning?
I did.
Okay, good. And then other than that, it didn't really sound like you had too much of any sort of medical history.
No.
Any problems with your heart or lungs that you know about?
No.
Do you ever get acid reflux or heartburn, anything like that?
No.
Okay, good. And then how active would you say you are?
Last couple years, not very.
Do you still do any exercise at all, or?
I walk.
Okay. Like, can you walk through the mall without having to stop because of
Yes.
shortness of breath or anything? It smells funny because it blows through new plastic, but it's just oxygen, no gas. After we have you breathe that for a few minutes, we'll start slipping a little more through your IV, and you'll probably start feeling a little goofy or a little sleepy. And then we'll give you the medicine that will make you fall asleep. That medicine sometimes stings, and it's normal. It's not damaging your vein, it's just the medication itself.
Okay.
But it only lasts a second because then you're asleep.
Okay.
After your sleep, we'll be putting in that breathing tube, and probably put in one more IV, bigger one. But you'll be asleep, so it won't bother you. Yeah, you won't notice. And then surgery will happen, and after surgery, we'll take that breathing tube out, and you'll find yourself in the recovery room. We take the breathing tube out at the very sort of line where you're just awake. So some people do have a vague memory of there being something in their mouth, there's something coming out of their mouth, there's, you know, just that sort of sensation.
Mm-hmm.
And that's considered normal because we do want you right at that point.
Okay.
Water-free hand cleanser. So my hands are freezing, but it's from the liquid. Did you have anything to eat or to drink this morning? Did you already have a chance to talk to Dr. Riquito, who's
Yeah, she just left, yeah.
Yes.
I saw her right around the corner. So. Any questions about the anesthesia part for the surgery?
Nice to meet you.
This is my friend Julie and my husband Steve.
Steve, pleasure. Julie, hi.
Hi, thank you.
You're being filmed, yeah, Julie
Yeah,
films
so,
everything.
You know, there are a bunch of us that come cycling through. It's a big team. At any given time, there'll be anywhere from 1 to 4 different surgeons scrubbed. Dr. Birchall does the critical portions of the procedure, and he's present for the whole thing. But a lot of times the initial, like, getting your hair washed, marking the incision, stitching you up at the end, is done by one of the other people that come through and say, hi, I work with Dr. Birchall.
Okay.
All right. I want to confirm that we're doing the right side.
Correct.
Okay, so I'm going to go ahead and mark that now that we agree so that everybody knows we're all confirmed. You're going to have a lovely yes right on your cheek. It'll wash off later.
That's fine.
Do you have any questions about the procedure, concerns, misunderstandings, anything like that?
Can you just tell us, like, when I go back to the room, will the wound be, will there be gauze around it, or what will?
No, we don't do head wraps. It's just some bacitracin ointment over it. We've found that the infection rate is no worse, and actually we have less wound complications with it uncovered because then people keep an eye on it. The tendency when you wrap the head is people are like, oh my God, the head's wrapped, I can't take it off. And you take it off 3 or 5 days later, and then only then do you realize there's a problem.
The wires, where will those be?
They come out through the scalp separately through a little stab incision in the scalp, usually a little bit behind where the main incision's made.
Okay. And someone, one of the nurses said that it just kind of gets coiled behind the ear?
Yep.
Is that right?
Yeah, right over that little bump behind the ear.
Okay.
Because eventually, if it works for you, what will happen is the electrode will stay in place. We change the wire since the existing wire is coming out, and it gets tunneled behind the ear and then down over the clavicle, and the generator sits over the clavicle.
Yeah, okay.
All right. And the last thing I want to confirm is no known medication allergies.
Correct.
Okay. Still taking the oxycodone?
Yes.
Well, we'll give you some more then here.
Oh, they're thinking about that omelet. Oh, I need an omelet bad.
I could use some lunch myself, but I'm sorry, none for you.
Some hash
You're
browns, little Tabasco sauce on there, yum.
Alright, well, we're gonna take good care of her.
Oh, I know. Okay, honey, we'll see you later.
You wanna wave bye to the camera?
Yeah,
Yes,
wave bye to the
please.
camera.
I'll try to get there we go.
Oh, here, let me get down the
Okay,
hallway.
shave your
Okay.
head bald and-
Bye.
They're only gonna shave the spot, it's even better. I know, I often wonder if I was in a position
All the lights in the back. There you go.
Hi, Julie.
Caitlin's doing awesome.